7 weeks after Governor Phil Murphy ordered residents to stay home and non-essential businesses to close to fight the spread, New Jersey's death toll from the coronavirus increased to at least 9,116 fatalities Saturday, with state officials reporting at least 137,085 total cases since the outbreak started in early March.
Officials confirmed another 166 deaths attributed to COVID-19 and 1,759 new positive tests in the 9 million resident Garden State, which has more cases and deaths than any U.S. state but New York.
Murphy said the daily number of cases and hospitalizations keeps dropping, but he has yet to give a definitive timeline for gradually peeling back his near-lockdown orders, saying the state risks the numbers jumping again if reopening is rushed. He has called on residents to continue social distancing and wearing face masks when going out to stores or parks.
This is the fourth straight day there were fewer than 2,000 new positive COVID-19 tests announced, even though deaths are up.
Murphy said the state is seeing the most progress in the number of positive tests that come back each day. It fell from the 50% range a month ago to 27% on Monday, he said.
The governor also said the total number of patients in intensive care is getting better, but not at the rate we'd like to see.
We are not out of the woods, folks, Murphy added during his daily coronavirus briefing in Trenton.
More than a third of the state's total COVID-19 deaths, 3,440, have come at long-term care facilities, such as nursing homes and veterans' homes. Those victims were lab-tested.
But the total number doesn't include 1,385 deaths at the facilities that were likely related to the virus, though the victim wasn't tested. In all, there were 4,825 confirmed and probable coronavirus deaths at the facilities as of Friday, 124 more than the day before.
Meanwhile, more than half of the state's known fatalities have had underlying conditions, according to the state's coronavirus tracking website.
On Friday, the state reported a 4-year-old girl with an underlying medical condition was the first child in New Jersey to die from COVID-19 complications. Officials declined to provide additional details about the child's death, including which town or county she was from.
On Saturday, State Health Commissioner Judith Persikilli said there is no indication at this point that the death was related to Kawasaki, a rare disease that has been linked to children infected with COVID-19. Persikilli and Murphy, however, would not disclose that the underlying medical condition was.
This is a very specific situation with this blessed little kid, Murphy said, adding he would not release any other details about how the child died.
There have been a total of 273,375 COVID-19 tests performed in New Jersey, with a positivity rate of 38.7%, according to the state's coronavirus tracking website.
Hospitalization update.
As of 10 p.m. Friday, there were 4,628 coronavirus patients in New Jersey's hospitals. Of those, 1,416 were in critical or intensive care and 1,054 were on ventilators, officials said.
All of those numbers dropped from the day before, officials said. There were 364 new COVID-19 hospitalizations Friday, while 422 patients were discharged.
So we continue to see more patients leaving the hospital than entering, Murphy said. All the numbers keep trending in the right direction, and it is our collective job to see they continue to do so. Social distancing is working. Wearing a face covering is working. ... And, the more we keep this up, the better positioned we will be to confidently and responsibly get ourselves on the road back, and we can begin to restart our economy.
Plasma donations.
Murphy also announced the American Red Cross will open 2 convalescent plasma collection sites in North Jersey on Monday. One will be at the American Red Cross Blood Center in Fairfield, and the other will be at University Hospital in Newark.
In late March, the U.S. Food and Drug Administration announced an initiative to collect blood plasma from those who have recovered from novel coronavirus to treat patients with serious or immediately life-threatening COVID-19 infections, Murphy said.
The plasma from recovered patients contains antibodies that may help others in their own fight against the virus. While this is a new advance against COVID-19, it is not a new practice, he added. Convalescent plasma has been used before as a potentially life-saving treatment against quickly developing diseases and infections, when proven treatments or vaccines were not yet available.
Murphy urged New Jerseyans who have recovered from COVID-19 to consider donating plasma. For more information or to sign up, visit redcrossblood.org/plasma4covid.
If you are eligible and qualify to donate, someone will get back to you to make an appointment, Murphy said. Additionally, other hospitals across the state also have begun their own plasma treatment efforts.
The pandemic has seriously damaged the state's economy, with more than 1 million residents having filed for unemployment since mid-March. Many also say they've had to wait for weeks to get paid and have struggled to get through to the state's phone and online systems. Businesses have suffered untold revenue losses, as well.
Meanwhile, lawmakers, businesses, and residents have been pushing Murphy to more swiftly peel back his restrictions. The governor allowed parks and golf courses to reopen last weekend, with social distancing guidelines. And with Memorial Day about 2 weeks away, Murphy said, he may soon allow beaches and boardwalks to reopen with similar restrictions.
Plus, he said he is considering allowing retail stores offer curbside service.
Murphy said Saturday he had a morning phone call with state lawmakers from both political parties about taking more steps to reopen the economy.
The faster we can break the back of the public health crisis, the faster we can reopen the economy, the governor said.
Murphy has formed a commission to draft a broader reopening. But he has said the state must meet milestones first, seeing daily case and hospitalizations drop for 14 days, widely increasing testing, and installing contact tracing and isolation programs.
The governor said he plans to announce more about testing and contact tracing early next week.
Coronavirus cases in each county.
Here are the latest county-by-county breakdowns of confirmed cases as of early Saturday afternoon, according to the state coronavirus tracking website.
There are another 557 positive cases in New Jersey that are still under investigation, with the patient's home counties not confirmed.
The total number of coronavirus cases is cumulative and does not reflect the likely thousands of residents who have recovered, officials said.
It's been difficult to get a full picture of how much the virus has spread here because state-run sites have so far tested only symptomatic residents, results have lagged for days, and the state has not yet announced significant increases in daily testing.
But officials announced Friday that the 2 state testing sites will begin allowing asymptomatic residents to get tested, starting Sunday.
As of Saturday morning, almost 4 million people have tested positive for COVID-19 across the globe, according to a running tally by Johns Hopkins University. Of those, more than 276,000 have died, including 77,344 in the United States.
Our journalism needs your support. Please subscribe today to NJ.com.
Brent Johnson may be reached at bjohnson@njadvancemedia.com.
Len Melisergo may be reached at lmelisergo@njadvancemedia.com.